Howdy everybody, my name is Jonathan. Welcome back to your MSK unit, and today we are continuing our adventure of the brachial plexus, and we will be talking about the musculocutaneous nerve. Let's get into it. Before we get into our slide, I think it'd be a good idea to go over our diagram and talk about the roots that lead up to the musculocutaneous nerve. C5 and C6 are going to join together to form the superior trunk, which will then go on to form the musculocutaneous nerve. Additionally, C7, which adds to the middle trunk, will have an anterior division, which then also contributes to the musculocutaneous. So as we just mentioned, going over the nerve roots of the musculocutaneous nerve includes C5 to C7. Importantly, this also includes the C5-C6 biceps tendon reflex. So in this reflex test, the biceps tendon is struck with a hammer in the antecubital fossa. In a healthy patient, this will elicit the biceps contraction, which will cause sort of a jerking motion of the arm. If there's nerve damage to the musculocutaneous nerve, there might be a reduced or a diminished biceps tendon reflex. Oftentimes, question stems will include the biceps reflex to rule in or rule out nerve damage. All right, next up, we'll talk about the motor innervation of the musculocutaneous nerve. Starting off small but mighty with the coracobrachialis muscle right here. This muscle will help flex the arm at the shoulder joint and also help stabilize your arm when you're carrying a very, very heavy weight. The musculocutaneous nerve also innervates the biceps brachii, this muscle here. Although commonly known as the reason for Tank Top Tuesdays, importantly, this muscle also flexes the elbow and, because of its insertion onto the radius, supinates the wrist. And the last muscle we'll talk about is the brachialis, this muscle here, which is a pure flexor of the elbow. Importantly, the brachialis has dual innervation. It's innervated medially by the musculocutaneous nerve, and it's innervated laterally by the radial nerve. And so before we move on, let's talk a little bit about these three muscles. So together, they sort of constitute the anterior compartment of the arm, and are responsible for both flexion at the shoulder and the elbow. Since this nerve innervates many of the big flexors of the elbow, oftentimes patients with injury to this nerve will have problems with flexing at the elbow or weakness at the elbow. Next up, let's talk about the sensory innervation of the musculocutaneous nerve. The official name for the nerve is the lateral antebrachial cutaneous nerve, but you're not responsible for knowing the name of the nerve as much as the area that it innervates, which is the lateral forearm. So here we have the anterior and the posterior view of the areas that are innervated by the musculocutaneous nerve. And what you may have noticed is that the sensory innervation of the musculocutaneous nerve is not actually that close to where the muscular motor innervation of the nerve is happening. And the way that I like to think about that is that as the musculocutaneous nerve comes off the brachial plexus, it has all this energy, and so it innervates all of the muscles that are up there, the coracobrachialis, the biceps brachii, the brachialis. But as it moves further and further down the arm, it gets tired and it doesn't want to innervate these big muscles. And so instead, it just settles to do the skin around the area. I use that to help me remember how the musculocutaneous nerve innervates the anterior compartment of the arm, but the lateral part of the forearm. And finally, we'll talk about some causes of injury to the musculocutaneous nerve. Injury to the musculocutaneous nerve usually happens with damage or compression of some part of the brachial plexus. For instance, damage or compression of the upper trunk, which would be right here, leads to a condition known as Erb palsy. This is pretty important and will have its own video, so we won't go into details here, but musculocutaneous nerve is among the nerves injured in that lesion. Additionally, injury in the lateral cord or even further down the line, here or here, might result in more isolated musculocutaneous nerve injury. Common causes of injury that you'll see in a question might be from trauma, from an accident or a dislocation, from lateral flexion of the neck, specifically if there's excessive traction when a baby is being born and they're sort of yanking on its head to pull it out. That can damage the brachial plexus and cause severe nerve damage. Or a tumor from something like a lung cancer can compress the brachial plexus and present with nerve damage. All right, let's do a recap and then we'll do a practice question together. The nerve roots of the musculocutaneous nerve are from C5, C6, and C7. The motor innervation is of muscles in the anterior compartment of the arm, including the coracobrachialis, the biceps brachii, and the brachialis. The sensory innervation of the musculocutaneous nerve is a little bit inferior to those muscles, and it will innervate the lateral aspect of the forearm. Common causes of injury are anything that can damage or compress the brachial plexus. So common things we might see in a question would be trauma, lateral flexion of the neck, or a tumor from a cancer. A practice question might sound something like this. A 33-year-old male presents to your emergency department after an injury while surfing. The patient reports that his surfboard hit him after falling on a wave. Vital signs show a blood pressure of 129/88, an internal temperature of 98.6 degrees Fahrenheit, and a heart rate of 78 beats per minute. On physical examination, you notice a diminished biceps tendon reflex and 3 out of 5 strength with elbow flexion. Which area of his arm might have reduced sensation from the nerve most likely injured in this patient? So in this patient, a diminished biceps tendon reflex and weakness at elbow flexion indicate musculocutaneous nerve damage. And so if we recall, the sensory innervation of the musculocutaneous nerve is going to be the lateral aspect of the forearm. All right, guys, that's all I have for you today. Join us next time as we talk about the axillary nerve, and I'll see you there.